So Minnesota's a leader in newborn screening, I think clearly, and we do a tremendous job. And the Department of Health at at Minnesota is great. So we're already leaders in this, but I mean Eric and I have been working on newborn screening for metachromatic leukodystrophy. So I didn't really talk about this in the presentation, but if kids are already affected by the disease and they're already symptomatic, we can't do anything. They progress so quickly and they're just going to die. So we have to, vast majority of the kids that were treated on the clinical trials were kids that were second siblings. So the initial brother or sister was diagnosed because they were symptomatic and they were going to progress and die because nobody can do anything about it. So, but their younger brother or sister who is yet not symptomatic from the disease, those were the kids that went on those clinical trials. So obviously that's unacceptable is to have to rely on a system like that. So we need to be able to identify these kids as early as we can so we can effectively impact their disease. And newborn screening is clearly the way forward for some of these kinds of disorders. So we've been working hard and Minnesota's going to be one of the first states that's going to start screening for metachromatic leukodystrophy probably in the next few months, I hope. So again, it'll give us the opportunity to see these patients first and intervene while there's still time to do that.
Do you have an idea of how many things are screened currently?
Erica does.
I believe we screen for 64
Something
diseases,
like that,
64,
I think,
65.
yeah.
They're getting added, there have been a few additions. So yeah, but in the mid 60s is what we screen for in Minnesota.
I'm sorry, maybe we should just mention because people may not recognize this, but when babies are born, before they leave the hospital, they do a heel prick and get a few drops of blood, and it just goes on a card. It's called a Guthrie card, and that goes off to the lab, and you can screen for these 64 diseases. So, again, people that just delivered a baby have other things to think about a lot of times, but that's how that works.
But for Joey, if you don't mind, before you go to the future, and maybe you'll sort of mention how genetic testing is kind of coming into the space. Before that, though, I would be remiss if I didn't say, I really think it is very important for all of us to continue to advocate for newborn screening and the value of newborn screening. Unfortunately, the federal panel committee that recommends what diseases are added federally was dissolved. And so it's really going to be up to the states to make sure they keep their programs strong. So newborn screening is just so fundamental, as Paul said, with so many rare diseases. Once those symptoms shows, it's too late for a treatment. So we need to make sure that we're really prioritizing newborn screening. And fortunately, we live in a state that is a leader. But let's keep that going. And then Joey, you can kind of take us into what the future looks like.
Yeah, let me get off mute. Classic me. So yeah, the one thing I do want to really quickly show is something. This is old data now. If it's from 22, but it's the cost of sequencing per human genome going back to 2001. So in 2001, it cost about that this much to sequence the entire human genome, and now it's dropped in 22 to about $1,000 per human genome for whole coverage. I do believe that Illumina in 2024 got the cost down to $200 per human genome. And the idea here is we're able to, through parallel processing and other tricks through the sequencing pipelines, do this at a hugely reduced cost. And with now to bring in AI into the space that can do pattern recognitions and process these large, massive data sets, and the talent we're even bringing in here at the University of Minnesota for bioinformatics, which is the process of taking those giant data sets and breaking them down and finding those patterns. It would not surprise me if there's an explosion in being able to identify what the root cause is for rare genetic disorders and get them, turned around relatively quickly in the future.